Today I'm doing PRP for hair growth, and PRP stands for platelet-rich plasma. So I've already drawn my patient's blood, I've spun it down into these 3 beautiful syringes, and I'm going to inject my patient's scalp with this. And the PRP, the platelets are going to signal to her stem cells to migrate to where this is, and it's going to help her hair be healthier and grow thicker. So it's not a treatment for somebody that has baldness, but it's a treatment for somebody whose hair is thinning. So, like I said, I've already drawn her blood and I put it into these 3 little syringes, and I use this to help with the discomfort. Okay, you ready?
Yep.
Okay, 1, 2, 3, here we go. Awesome. So good. She's a rock star. Couldn't be better. So just little tiny aliquots. I'm gonna go a little bit forward. I know this is probably not the easiest place for you. Okay, now we're gonna go backward. And so I love to do this in a series of 3 to start, and then I recommend 1 a year. Now we're coupling PRP with a treatment called Derive, which are plant-based stem cells. So you could do microneedling, like right after this we could microneedle Derive in to help even more, or it's a great treatment to use as the year goes on. So our patient is in a maintenance phase right now, so she'll come back in about 2 or 3 months, and then she'll do a 6-month treatment with the plant-based stem cells to help her hair grow even during the time that she's not doing the PRP. And Derive is once, so you do it month 1, month 2, month 3, and then there's just take home serum for month 4 and month 5, and then another treatment on month 6. And treatment in office is ultrasound or microneedling or our Aquafirm, which helps push the Derive serum into the scalp. So that is that treatment. But I love PRP as a starting point. Okay, I'm gonna have you look up now. Okay, and so I'm gonna go in the middle now, okay? Do you need a break, or are you okay?
No, you're good, girl.
Okay, we're going. Yeah, sometimes it's just better just to
Get her done.
get her done. And so PRP you can use for lots of different reasons. So right now we're doing for hair regrowth, but you can microneedle this into the face, and it helps to restructure. So it makes you make brand new collagen, elastin, and fibrin. We can use it as filler. So we could put it in your cheeks, in your lips, your nasolabial folds, and your marionettes. And it, again, will stimulate your stem cells to migrate there, and therefore make brand new collagen, elastin, and fibrin exactly where you want it. Lift your head for me a little. The nice thing about doing it as filler is that then you can see what filler would look like if you've never done filler before. Sometimes we'll combine it with filler, and we'll do filler first. So as the filler breaks down over time, the PRP is kicking in and is making you make new collagen as the filler breaks down. So those are a couple other places. Turn this way, perfect. We do a lot of PRP breast lifts. So we inject PRP into the chest wall, into the breasts, and then the stem cells become brand new adipose cells, which is what our breasts are made out of. And it gives a lift. It can also increase the size of your breast by 1 to 2 cup sizes, which is fabulous for those of you that want bigger breasts but don't want to undergo surgery. Although I cannot predict that it's going to do that. It all just depends on your blood. And then we do PRP for sexual function as well as for stress incontinence. So that's called the O shot and the P shot for men. So lots of reasons and lots of different ways we can use PRP. So now what I'm going to do is I'm going to use my platelet pore plasma, and I'm going to put this all over her scalp, and then we're going to microneedle this in because we have this leftover serum and we don't want it to go to waste. So we're going to microneedle this in. The microneedling itself will help with hair growth, but why not just use platelet cord plasma too? There's still some platelets in there. It's not like there's none, but it's not like the amount of platelets in the platelet-rich plasma. So now we're going to microneedle. And let's just real quick. So I always like to think about PRP for the scalp like gardening. So what we do is we use a shampoo that we give you to help get your scalp ready, like getting the soil ready, having good soil. Then we plant the seeds by injecting the PRP. Then now we're rototilling by doing, have you not heard me talk about this like this? Okay, so we're rototilling your head right now. We're using microneedling. And then she's using a serum at home that's like Miracle-Gro. And then she also is using a scalp cap, a laser cap, that's like the greenhouse. So individually, those things can help with hair growth, but when you put them all together, it really helps. So, and our patient here has said that she has had really nice results with PRP. How many have you done? 3?
3, yep.
3. And then once a year, right?
Yeah.
Yeah.
It's been awesome.
Yeah. Her hair is really a lot thicker, but I always recommend doing maintenance for everything because, we don't want to lose what we started with or what we regained. But that is it. So if you want to find out if PRP is right for you, or if you want to find out about any of the over 65 procedures we do at Rejuvenation MD, you can find us online at RejuvenationMD.com.